limited hours. Announcements in this regard will be made once we have concluded discussions with the sector on the various conditions. The sale of tobacco products will remain prohibited in alert level 3 due to the health risks associated with smoking. All gatherings will remain prohibited.
What's up, everybody, and welcome to another episode here on South Africa Uncensored. Now, today is a joyous day. Today is June 1st, and that means it's the start of the level 3 of the lockdown. Now, the South African government has released a breakdown of what level 3 is going to entail. So we're going to go through that today real quick. I'll try and make it as short as possible. Right at the top, summary of regulations, alert level 3. Questions. When can I leave my home? You must remain at home at all times except to travel to and from work, attend a school or learning institute once these are opened, purchase goods or obtain services that are allowed at level 3. Now, there has been some speculation about what these goods are and what will be allowed to be sold. We're going to get to the good stuff later. Exercise. You are allowed between 6 a.m. and 6 p.m. and not in groups. Okay, so this is a bit better than level 4, where you're only allowed to go between 6 and 9 in the morning. Now it's 6 to 6. So now you have 12 hours of exercise time, or 12 hours to think about going to exercise, or just stay at home and sit on the sofa. Workplace protocols. To keep workers safe, employers must minimize the number of employees at the workplace at any given time through rotation, staggered working hours, shift systems, remote working arrangements, or similar measures to limit congestion in public transport and at the workplace. Okay, so they're taking two sides of this. Very important. Minimize the number of employees and limit congestion in public transport systems. So a lot of people are going to be using buses. They're going to be using trains to get to and from work. And they're trying to keep the amount of people that is bunched together to a minimum as well. Make arrangements for social distancing at work. Provide sanitizer or facilities for hand washing. Okay, so most workplaces are supposed to have bathrooms, or should be situated where someone can have access to a bathroom. But then, as experienced in South Africa, a lot of these bathrooms don't have soap. They don't have hand sanitizer ready because people either just steal it or waste it, or whoever is in charge of the facility doesn't pay or want to pay for the soap or hand sanitizer. So they're going to be looking for, a lot of these companies, they're going to be looking for some kind of government handout. Sanitize surfaces regularly. Again, how is the government going to be regulating this? Sure, a responsible employer would be enforcing this rule, but are all of them? Screen employees for symptoms daily and assist those at risk to seek treatment. Now, again, you're going to have to scan your employees. I know a lot of schools are struggling with this. To implement these systems, they're going to have to scan and take the temperature of everyone and make sure that they're wearing masks, all this kind of stuff. It's all good and well. All right, these same rules have been applied all over the world, but is how it's going to be regulated that in South Africa. That's the big question here. Economic sectors. All economic sectors are permitted to operate except for high-risk activities that remain restricted. The following restrictions will remain in place. All right, so here's the coming to, this is not going to change. Consumption of food and alcohol in restaurants, bars, shebeens, and taverns. Okay, so you cannot go to a restaurant yet. You cannot sit down at a restaurant or a shebeen or a bar or a tavern. Personal care services where social distancing is not possible. Consumption of food and alcohol in restaurants, personal care services where social distancing is not possible. Okay, so again, services in places where you cannot, withstand the 1.5, 2 meter distance from someone, then it's not going to work. Hotels and accommodation for leisure. Domestic air travel except for essential work travel. Again, so no flying is allowed yet domestically. Conferences, events, and gatherings. Strictly out. No gatherings, no large weddings or anything, no funerals over than 50 people. Cinemas, theaters, museums, and other entertainment venues are also closed, okay? Gyms and fitness centers still closed. Now, this one I totally agree with because, as in most gyms, people don't wipe their machines down. You're going to be spreading that virus so quickly. It's a nest for disease. Beaches, public parks, sports grounds, and swimming pools. Now, this one I still don't agree with. If you apply proper social distancing, there's no need to close parks. What goods can I purchase? All retail outlets will be open with stringent health protocols in place. Alcohol will be sold under strict conditions from Mondays to Thursdays between 9 a.m. and 5 p.m. The sale of cigarettes and other tobacco products remains prohibited. So again, we're coming back to the BS about not selling cigarettes. There's underlying reasons, people. There's underlying reasons. It's not protecting the health. Protect yourself and others. Most people who are infected with COVID-19 have no symptoms. That's very true. A lot of carriers of the virus are asymptomatic, which means they will not be showing any kinds of symptom, but are still able to carry the virus. You may be spreading the virus without knowing it. Also true. Wear a mask, wash your hands regularly, and keep your distance from others at all times. Hotspots. Hotspots will be determined based on the number of active cases per 100,000 in the population, the rate of the increase in active cases, and the capacity of the health system. Special measures will apply in hotspot areas, such as movement in and out of hotspot areas may be restricted. May be restricted? What the hell does that mean? May be restricted. Is it going to be restricted or not? People need to plan, especially if you're going to be working. Dedicated multidisciplinary teams will be deployed to contain the outbreak, including epidemiologists, doctors, nurses, and community health workers. Multidisciplinary teams. Sounds ominous. What's that all about? Tell me in the comments below. Each hotspot will be linked to testing and quarantine facilities and additional hospital beds where necessary. Okay, great. That's good. All contacts will be traced and isolated to prevent further transmission. Now, I know South Africa does not have the resources or the technology or the software to be tracing people. How are you going to trace someone? If someone gets on a bus with a bunch of other people and he's infected, and they come to the, say for example, the Pretoria CBD, and there they part ways, and how are you going to trace everyone that was on that bus? So Africa simply does not have the infrastructure to do it. Private household employment. So they're talking about the cleaners and that stuff. All staff employed by private households may return to work. So great for the South African economy. I know there's a lot of people that's going to be struggling, especially the more rural areas, and the families that are dependent on being household workers. They've been struggling hard because they also are they're not making any money because they cannot come to work. And employers must take measures to ensure a safe working environment. So again, this is all good. I'm totally in agreement with all this. Everyone should be safe. You should not feel unsafe when going to work. Special measures for the most vulnerable. Now, who are the most vulnerable according to this thing? Let's see. All those above the age of 60 and those with underlying medical conditions should leave home only in exceptional circumstances. This is again very true. Anyone above the age of 60, I'd say more than 50, but okay, according to the official documentation, the age of 60 and above are more likely to be suffering from some severe symptoms. Employers should allow them to work from home where possible, or put special measures in place to facilitate their safety at work. Absolutely. Gatherings. All gatherings are prohibited, except for places of worship with 50 people or less, depending on the size of the venue and following strict health protocols. Now again, you are allowed to go to church now, but only with 50 people. Funerals with specific restrictions. Okay, I remember in level 4 they said you're not allowed to attend a funeral if there's more than 50 people. Workplaces with social distancing guidelines adhered to. Okay, so again, if you can have social distancing, you are allowed to go to work. Agricultural auctions. So you're allowed to go buy a bull or a sheep if you adhere to these restrictions. Professional non-contact sports matches, but with no spectators. So again, any contact sports, rugby, any of that is completely out of the question. Evictions. No person may be evicted from his or her land or home during the period of alert level 3. So again, I totally agree with this one. I think it's a good measure to be taking. You are not allowed to be evicted at this time. A court may grant an eviction order, but this will be stayed and suspended until the end of alert level 3. So now that's different from level 4, because in level 4 they said if you get a court order to be evicted, then you are out. But now it says even if you get in level 3, even if you get a court order, you are not allowed to be evicted, court order or not. Movement between provinces. Movement between provinces is prohibited except for carrying out work responsibilities or performing any service permitted under Alert Level 3 where a permit has been issued, moving to a new place of residence, moving to care for an immediate family member. So again, if someone in your family is sick, you are allowed to go and take care of them. Moving to care for an immediate family member. Members of Parliament performing oversight responsibilities. Sounds like a loophole. Members of Parliament performing oversight responsibilities. I wish they would say more about that. Learners commuting to attend schools or institutions of higher learning. Now again, this is a very interesting one because just previously they mentioned you need to limit the amount of people that is taking public transport. But I know for a fact when I was at school, my high school, the majority of the learners in high school had to take South African vans or South African taxis. They would cram as many students as possible into those taxis. It says 15, but I've seen people get into 20, 22. Easy. Get crammed into a taxi because there's a limit on the amount of taxis that are available. So all the kids, they want to cram as much as possible into that van. And that is, again, a recipe for disaster. Obtaining medical treatment. Okay, yes, this one is very important because I know for a fact that my hometown does not have a hospital anymore. The hospital went completely bankrupt because of mismanagement. And now, say for example, if my family back home, if they want medical treatment for anything, be it COVID-19, a heart attack, or God forbid anything happens to them, they have to travel outside the province to find a good hospital to go to. So I like this. Persons who are returning to their place of residency from a quarantine or isolation facility. Yes, of course, those people need to go back home. Transportation of fuel, cargo, and goods. So again, the economy is getting a bit of shine here. Closed borders. All borders of the Republic remain closed, except for the transportation of goods, repatriation of South Africans, and evacuation of foreign nationals. Okay, we all know this is not true. Okay, officially they might be closed, but this is not stopping anyone from running across a river. We'll be talking about that very soon. All right, thanks for watching, everyone. If you liked the video, please hit that like button and share with your friends. Don't forget to subscribe, and I'll see you in the next one. Cheers.